I'm Dr. Suhas Haldipurkar. I'm the specialist in cataract and glaucoma and refractive surgery. As you all know, among the avoidable blindness, one of the major thing is cataract. Camera has got a lens and even eye has got a lens. When that lens becomes opaque or there are some smudges on a camera lens, the product that comes, the photograph, is hazy. Similarly, when a crystalline lens in the eye becomes slightly hazy, the picture starts becoming blurry. Cataract surgery is probably one of the most advanced and most highly performed surgery in the world, because everyone, if he lives long enough, will get cataract at some stage. Child is born with cataract. Sometimes in the childhood you have developmental cataracts. Sometimes a trauma can cause cataract. Sometimes some metabolic diseases like diabetes can lead to cataract formation. And the biggest chunk of them is the age onset or senile cataract, which we see in most of our patients. Practically everyone after the age of 50 will have some amount of cataract, but unless there are symptoms, you really don't need treatment. And what are the symptoms? Some of the earliest symptoms that a cataract patient would come with is glare in the evenings. Like if you're driving or if you're looking at bright light, the light spreads and you have that glare. And then the next complaint normally a patient comes with is, he says when he reads at night, he needs to have brighter light to read. And then most of the symptoms start coming, and even in the daytime, your distant vision becomes slightly blurred, or sometimes, repeatedly you need to change your glasses frequently because the spectacle number continues to change. So these are some of the symptoms a cataract patient will have. And when the cataract really becomes advanced, your total sight becomes lost. But normally in these days, nobody waits for that long, because in the present fast life, even with a slight blur in the vision, you would definitely approach a doctor. And that's the reason we advise patients that go for a frequent checkup after the age of 40, because very often, you'll have cataract and you wouldn't know about it, and unless you examine, you don't come to know.